findings from the RECAP project. So this was a project that looked at the what, how, when, and who of sharing trial results summaries with trial participants. And so the main thrust of this project was generating stakeholder-informed guidance. So whilst the bulk of today, I'm going to talk to you about some of the findings and reflections from RECAP, I'm also going to bring in some research from other groups, and then also hopefully get some audience participation as well to get you thinking about what you might need to be doing next. Okay, and now it's not letting me move on. Hold on. There we go. Okay, so there are lots of reasons that might support the justification to share overall trial results with those who participate in the trial. But to me, one of the biggest compelling reasons is from a review in 2008 by David Shalowitz and Frank Miller. And they demonstrated that around 90% of people who take part in research want to know about the results of those studies. And I imagine that figure has either stayed the same or gone up since 2008. So we know that 90% want to receive the results. This pie chart donut here shows you that not many of them actually do receive, around a third actually receive the results, with many not even having an opportunity to receive the results of the trial that they took part in, that they made possible. It's also an interesting reflection when we consider there's evidence that actually receiving the results of a trial can be an important factor for people when they're making a decision about whether or not they want to take part. We know that less than half of research teams actually provide results to trial participants. And we know that there are lots of barriers in place that stop people being able or sometimes the behavior of actually doing it to work that through. And we're going to talk through that in a bit more detail. And it's also important to consider that whilst there's an ethical and moral imperative to share the results of trials back with participants, we also need to recognise that there might be unintended consequences and that there's also the potential for harm. Okay, so to give you a little bit of context, and today when I'm talking about RECAP, I am predominantly talking about a UK context, but most of our findings would be relevant for all other jurisdictions as well. So in 2018, there was a parliamentary select committee investigating research integrity and transparency in UK clinical research. And in response to some of the recommendations from that select committee, the Health Research Authority, so the HRA, who protect and promote the interests of patients and public in health and social care research in the UK, they launched their transparency agenda and the Make It Public campaign in 2019. So luckily for them and serendipitously for us, RECAP was actually funded in 2017. And one of the pillars of Make It Public was around letting research participants know about the results of the research they took part in. And RECAP had been funded by the Academy of Medical Sciences to look at how we can report clinical trial results more appropriately to those who've taken part. So this was a really great opportunity for us, but I think also for the HRA, that we could work together to look at how this research was also able to help inform policy. So before I get into the meat of what RECAP did, there's a bit of audience participation here. So Tom, I think you're going to launch the first poll, which is, it's a yes/no answer. So you just need to say yes or no. So do you currently share the results of trials you run with your trial participants? So we can see that coming in, and we'll see what, I think there were about 40 people the last time I checked, or 57 participants, but let's see what numbers we can get up to. So we have about 22, 23 who've come in, 24, let's see if we can get it higher. So yes, no, do you share the results of trials you run with your trial participants? I'll give you another minute or so. Yes, no, well, not a minute, seconds. See if we can get to 30. One more person. Let's see if we can get to 30 out of the 57. There we go. Okay. So let's close that with we'll say about 75% of you are saying yes, 74% are saying yes, you do share, and 26% saying no. So you're probably atypical. That certainly some of the reviews that we have done suggest that those numbers at a population level might be smaller, but that's great. You guys are clearly already doing it. What will be interesting as we go through is to look a bit more at how you're doing that. So to come back to RECAP for a second. Okay, so RECAP had 4 particular phases. It was a mixed method study. And each of these components built iteratively on each other to develop evidence-informed, stakeholder-based recommendations. So today I'm not going to go into the detail of each of these components. I'm going to give you high-level headlines from what each of the phases found. So the first of these was around current practice. So what was happening currently with regard to sharing results with trial participants? So to answer this question, we had a medical summer student, Zulfi Raza, who conducted this piece of work. And essentially, we conducted an audit of the Health Research Authority's application system. So it's called IRAS. I'm conscious now trying not to use jargon after Eleanor's talk. Integrated Research Application System. So essentially, it's the ethics application system in the UK. It's an online form. I'm sure you have very similar in Ireland. And one of the questions within that form is, do you intend to share the results of your trial with participants? So we conducted an audit, phase 3 pragmatic effectiveness trials. I'm happy to talk in the panel session about why we chose phase 3 and why we didn't consider all types of trials. So we had just over 1,200 applications, and 88% of them, the teams said they intended to share results with participants. And of those 88%, around 80 of them proposed largely passive methods. So often, sharing of, they said they were going to publish their results in a medical journal, or that participants could have the opportunity to access the results if they themselves made a request to do so. Interestingly, not on this slide, but only a very small proportion said they were going to involve patients as partners during the dissemination of the results. And again, we can talk about that in the discussion of whether we think that's appropriate or not. So whilst 88% intended to share the results, only a very small proportion, so here 2.7, and to be fair, this is probably a slight underestimation because of the way this information is reported, but still, it's not going to be huge. A small proportion reported actually sharing the results. So there's an intention to share the results, but that's not translating into behaviour. So we're not seeing trialists actually sharing results at the end of the trials with their participants. And there could be a whole host of reasons for that. And there's some really nice work done by Sarah Schroeter, published in BMJ Open, where they did a survey of the top 5 medical journals, looking at those trials and asking trial teams why they did or didn't share those results. I'll pick up again on that later on. So the other component in terms of current practice as part of RECAP was we conducted a scoping review. And in RECAP, I have to acknowledge Hannah Broom, who was the research fellow working on the project. So Hannah led this review, a scoping review, looking at, again, phase 3 pragmatic effectiveness trials to say, well, what does the evidence tell us about how this is currently being done? What are the best methods? And really the headline here is that there is no high quality evidence to support the best method for sharing results. So we found a range of different study designs. We only identified 2 randomized comparisons. So that's where trial teams did a SWOT, so a study within a trial, and they compared one method of sharing results with another. Both of those studies used different outcomes to report the effectiveness, and so we couldn't combine them in a meta-analysis. Lots of the other studies were survey-based or qualitative, exploring people's experiences of receiving those results. And whilst informative, again, we can't deduce a best method from that information. Also importantly, the majority of these studies investigated the dissemination of aggregate results, so the overall trial result rather than individual. And again, that'll come up later on. And there were various modes of delivery used as well across these types of studies. So whilst we only identified 2 randomized comparisons, in the meantime, another study has been published. So this is Annabelle's study, which is a really neat design. So Annabelle just didn't decide to make it easy and do a direct head-to-head comparison of different ways of sharing results. She designed a cluster randomized factorial mixed methods trial. So this is published in PLOS ONE if you want to have a look. But a really, we need to think smart about how we are evaluating these types of approaches and get the biggest bang for our buck, try and get as much information out of these studies when we're doing them. And Annabelle's, again, randomized comparison will definitely add to the literature and means if we get more of these studies, we will be able to deduce the best method for sharing trial results with participants. Okay, so to come back to recap again, so I've told you about current practice. The next step in recap was looking at trying to get consensus on the content. So what information should we be sharing with participants? So to do this, we used two main methods. So the first was a Q methodology approach. So it's illustrated here in this image. So you have statements, and our statements were generated from existing guidance on sharing results. And those statements are given to a participant, and they're asked to then place those participants on a grid where one end is most important and the other end is least important. And whilst they're placing those statements onto the grid, they're asked to think aloud, to talk out loud about why they're placing statements in a certain position. So you get quantitative information about the level of importance, but you also get qualitative information about the reasons why people think one item is more important than another. So we conducted these Q methodology grid sorts with members of the public who had or hadn't taken part in trials, ethics committee members, sponsors, regulators, funders, and trialists, and asked them to rate these different items. And that then gave us a list of prioritized items that we could think about what needs to go into a results summary. We then used that information to score existing results summaries that we put a general call out for. Again, this is kind of current practice. It tells us what information is currently being shared and what the gaps might be, but also gave us an information bank of items, and some of these had actually done a really good job. So that was good to start to generate a repository of some good practice examples as well. So again, without going into the detail of the Q methodology results, the recap came up with 4 guiding questions, so 4 core guiding questions of what information you should think about including in a results summary. So the first is, what question did the trial set out to answer? The next is then, what did the trial find? So what were the results? What effect have the trial results had, and how should they change the NHS or the healthcare system or the treatment? And how can I find out more? And within the recap paper, we've also provided the key topic areas. So it might be, the primary and or the secondary outcomes, and a description for how you would describe those particular items in a lay summary. One of the things we didn't bottom out, I don't feel, in recap, two things really, and I mentioned this earlier, was this idea about sharing individual versus aggregate results. And also the issue around unblinding. So if people are in a blinded trial, so a trial where they don't know what treatment they have received, should we be sharing that information, and how do we share that information when we present results summaries? So this is quite a busy slide. The first piece of information is to highlight that this work was done by Jess Wood, who's a trial manager with us in Aberdeen, and this was done as part of her master's project. And it was set within 2 trials within mesh for vaginal prolapse repair, and we're going to talk about trials like this which are slightly politically sensitive, and Jess asked women in these trials again to rank the information. This was done in focus groups or interviews, to rank the information and then to explain why they felt these items were most important. But what's interesting are the 2 items in green, first of all. So in the VIEW trial, women had said that the most important item was a summary of overall trial results. Whereas in Prospect, they were asking, could they be given the individual results? So they wanted to know how they had done compared to other people. And then the item in orange is the item that talks about, if you didn't know, information about the treatment you received, so unblinding. And this came in both groups of women were interested in knowing that information. So again, it's important to think about the context of your trial, but also how you may or may not be able to share information about unblinding or individual level data with your participants. Okay, so we've talked about the current evidence, we've talked about the what of sharing. Now we're going to move on to thinking about exploring delivery. So how? So this is the next poll. So Tom, if you could launch the next poll, please. So thinking, for those of you who said yes, and that was a significant number of you, how do you share the results of the trials you run with your participants? So there are a few options here. So there's scientific publication, a letter, email, face-to-face, on a website, social media, or video. So I'm not sure, sorry, I should have checked. It's a single choice. So this would be the main one that you use. I'm sure that some of you use a number. but it'd be interesting to know which is the main one. So again, how do you share the results of trials you run with your trial participants? So we've got 14 responses. Let's see if we can get back up to, it won't be exactly 30 because not all of the 30 said they were sharing, but I think we can get above 20. So it's good to see there's a mixture. So scientific publication, letter, email, websites. Okay. So I'm happy to close it there. We've got around 23. So at the moment we've got letter. So postals probably would be the most frequent, which is also what we found in our scoping review. Scientific publication seems to be coming in next. Again, that seems to be shared across the a lot of the work that's been done to date as well in surveys. So let me click on to the next one. Okay, so in terms of how results should be shared, so we can see there that, you've already shared that largely what tends to happen is that it's within an academic publication, or sometimes it's through postal letter. Other types of approaches that are being used as well are through social media, infographics, online videos as well, telephone, and sometimes, but less frequently, there are face-to-face examples. And I don't have time to talk about it today, but again, Hannah Brune was involved with Sean Treweek and Annie Anderson in Dundee, where they have published a really nice paper, letter in trials, talking about an online event they ran during lockdown to share results with women who'd been involved in a breast cancer screening trial as well. So check that out. For instance, they also include costs of that event. So I think that's really helpful too. So when we ran focus groups in recap with a whole range of stakeholders, here's some of the things they said about how results should be shared. So in blue here, this person's saying, well, things change. You might decide to present the results differently after 10 years. So they're identifying, what you decide at the front end of the trial might not be appropriate by the time you get to the end. And here in yellow, this person is saying, well, it depends on what the research is. You might need different modes, might be appropriate for different methods of research. So it depends on what the research question essentially is, what this person in yellow is saying. And in green here, this person's saying that they received the results by teleconference, and people actually had a chance to sit and think about how they felt. They got to hear the news in the privacy of their own environments. So this to me is really starting to talk to, the results of the trial might also have an influence on how you need to share that information. So here really it was agreed that a flexible plan should be in place from the outset. Ideally, there should be an opportunity for participants to choose how they would like to receive the results. At that point of seeking consent and enrolling patients into your trial, asking them, well, at the end, how would you like to receive this information? And again, you may need to check in on that over time. There was also discussion about this idea of layering of information to respond to individual preferences. So for some people, a very brief infographic with the primary outcome and what happens next might be enough, whereas others may want to know all the different subgroup analyses and may want individual results. So it's important, again, to check in with your participants to see what would be appropriate. But it's also important to think about the pros and cons of various methods of delivery. So, consider the demographic and the contextual factors of the population and think about what might be appropriate in different settings. And this is, I think, particularly important when you're thinking about what the results. So you might want to do some scenario planning. So if your trial demonstrates that the intervention is more effective than the comparator, that might mean one thing. It might mean something very different if there is no effect. It might mean something that the need to share results is completely different if there's actually evidence of harm. So it's worth thinking through all of those things at the front end. So to give you a couple of examples of different ways in which results have been shared. So the first one, and sorry, this should be on top of one another, but I had to cut it so that it was big enough that you could see it on the slide. So this is an example of an infographic that was developed by Beatrice Goulau, who's a statistician in our CTU and chart in Aberdeen. And Beatrice developed this with our patient public involvement group. So it was a trial set in dentistry, looking at whether scale and polish was, or personalised advice improved gum health. And you can see that it starts off with a summary of the number of participants, what they were randomised to, the types of interventions, and then the results, and then who you can contact for further information. The next example is from a trial in Cardiff called Ostrich. And this is, I'm just going to show you a brief clip of it. It's a hand-drawn video, and it was actually shared. The paper was published in The Lancet, and The Lancet also used this as a method of communicating results. But this is a neat way to share results with participants as well.
Hello, my name's Dr. Nick Francis, and I'm one of the study team that worked on the ostrich study. So why did we do the ostrich study? Glue ear, otherwise known as otitis media with effusion, is a condition where fluid builds up behind the eardrum and causes hearing problems. It's common in children, but often gets better by itself in a few weeks. However, some children have problems with hearing for much longer, and this can affect their confidence, language development, school performance, and mood. Most children with longer-lasting hearing loss from glue ear are offered surgery to put small tubes, called grommets, through the eardrum, which allows the glue stuck behind the eardrum to drain out. This improves hearing, but involves a general anaesthetic, and it's sometimes only helpful for a short time. A treatment that works well and does not involve an operation would be of great benefit. Previous research studies have suggested that a short course of steroid tablets, such as those taken by children with an asthma attack, might help glue ear clear up. But these studies could not tell us for certain if this treatment is helpful. So we decided to do a large study to find out if steroid tablets really do improve hearing loss caused by glue ear in children.
Okay, I'm going to pause it there in the interest of time, but do check it out if you want to watch that video in full. So the next example, the last one I'm going to share.
So how did we do the ostrich study?
Hopefully it's going to go on. Yeah, going to go on to the next one. So this video is from the clinical trials unit where Annabelle works, so the MRC CTO at UCL. And I think this is one of my favorite videos. I'm going to play it and then I'll give a little explainer. So this is, sorry, just to say, so this was sharing results in a trial that was looking at when you should start treatment. Okay, so I'm going to stop that one there. But really what I hope you can see across the different methods is that, again, so context matters. So it's really important to consider all aspects of your trial. So the population and potentially the cultural context. What might be appropriate in one setting may not be appropriate in another. You need to think about as well, is the intervention politically sensitive? Is there anything you need to consider about how and when you're going to share those results? And also thinking about the outcomes. So what's the best way to get that information to the population who need to hear about it? Okay. So when we talked to, again, the participants, and this was the stakeholders, as I've mentioned before, so patients, ethics committee members, sponsors, regulators, trialists, about when results should be shared, the key things that, that they talked about. So here, the person in blue, in the blue speech bubble, is saying you need to get the results when everybody has finished the trial, and making that clear to participants at the outset is important. They need to understand that it's about the final patient completing. So you need to tell people when the analysis is going to be complete. So you need to set realistic expectations with patients at the outset about what they can expect to receive and when. In yellow, this person starts to pick up on the idea, well, not everybody manages to complete a trial. They might have to withdraw, but they still might be really interested in knowing when it's complete, when the analysis is being done, and when findings are available. So you need to think about how you're going to deal with people who withdraw from your trial, and how you're going to make sure they have the opportunity, if they want to receive those results. And then in green, this person's saying, so they had a friend who took part in a trial. The first she knew of the results was when she read it in the daily paper. You can imagine how that made her feel. She hadn't had any results. So really, when you're thinking about the when and the timing, ideally, participants should be the first to know the results. Now, clearly, there's some operational challenges around this, that with some journals, the results might be embargoed. but there's certainly a move towards ensuring that participants are amongst the first, so that there might be information that's shared with them at the point at which the publication goes live as well. Okay, so we've done the what, how, when. The last part of this is then the who. So who should share the results? So when we had these discussions with the recap participants across the different stakeholders, there was discussion about, that everybody has a role to play. And I think that we really need to work that through, of thinking about, consider these broader responsibilities that all of us who are within a trial endeavour have a role to play, making sure that participants have the opportunity to receive the results of the trials they've taken part in. So that might be, there may be an institutional position, there may be funder responsibilities, ethics committees, journals, chief investigators, but ultimately what came out of this, and certainly within the UK, the responsibility will sit with the sponsor. I thought it was also interesting when Fiona was talking this morning about impacts, that I would really get us to start thinking about, from, again, within the UK, from a REF position, so the Research Excellence framework, is thinking, should we be saying what papers we've published in academic journals, or actually, as a better measure of impact, how many patients we've told about the results of the trials they took part in? Okay, so the last part of audience participation, and I don't want you to type, so this is going to be, you're going to type something in the results, although I'm actually just looking at the time, Tom. I think we'll probably skip this because I've got 3 minutes left. So what I was going to get you to do, and do think about this, and it'll come up in the next slide, is I've shared the guidance with you about, or the recommendations about what we say you should do, but how do we know when we've done a good job? So how do we know that when we've shared results with trial participants, that it's had its intended outcome? So when we look at what's been done to date, so the review I talked about, when it was assessing how this had been done, it looked at patient understanding or satisfaction with how results were communicated. But other types of outcomes that have been mentioned that should be considered are the need for further information, feeling valued, that their trial expectations had been met, whether or not they would participate again in the future. But then these unintended consequences, or the potential for harm. So did they then regret their decision, these participants, about taking part? Or has it increased their anxiety? Now they know something about the treatment that they received or an outcome that they experienced based on sharing the results. And really a great example to demonstrate this issue of harm is a piece of work done by Carolyn Tarrant and colleagues a few years back now, where after women who'd been in a trial had received the results, they went back and interviewed these women and said, what was that like, experiencing those results? And I'm going to read this out to you. So this statement in the results and discussion, where they say, for some, the results provoked recognition that their original expectations might have been mistaken, or that they had not understood the implications of their decision to participate. These participants experienced guilt, a sense of betrayal by the maternity staff and researchers involved in the trial, and damage to trust. So this is something we should all be avoiding. Eleanor mentioned in her talk, this idea of poor communication can lead to mistrust. This is, I think, the worst example of that. So it's really important to consider that the information shared at consent is clearly really important to get right, especially when we consider that, when I mentioned at the beginning, that patients who are considering taking part in a trial use the information about whether or not they'll receive the results as informing that decision. So the last piece of information I'm going to share with you is from a piece of work that Frances, Sheila and I did together with a summer intern called Matilda Bjorkland. And so we looked at a sample of 238 patient information leaflets that had been collected for another project. And we asked the question of, are they explicitly telling patients that they're going to receive the results of the trial? So this is at the point of consent. So whilst around 3/4 of them did tell patients that they would receive the results, often that information was, you will receive the results of this trial. So, quantity, not quality, probably in this one. But less than half did not provide a time frame. So it was you will receive the results, but there was no idea when and how that would happen. So again, we need to get better at this. Okay, so some key considerations. Again, picking up on something that Eleanor said, know your audience. I mean, I think that is the biggest thing, is think about working with patient partners for whom similar populations will be receiving those results. Involve early and through all aspects. You need a proactive dissemination plan from the start, and it needs to be resourced appropriately. Build it in. Funders should be asking to see this if it isn't costed. Consider who the audience is. If results aren't to be shared because they're politically or culturally sensitive, this should be justified in advance to the participants. You need to think about how to deal with participants who are withdrawn. When thinking about the mode of delivery, it should be developed in consultation with your patient partners, and ideally ask your trial participants for their preferences. You need to consider the timing of when the results will be shared and how it will be operationalized, and consider who else needs to be involved. It might also be that your team needs training in how to write lay summaries. And also funders and regulators should hold a repository of good practice so that we can begin to set examples and provide examples of how this has been done well in the past. So I would encourage all of you today to think about how you will ensure that participants in your current and future trials have the opportunity to receive the results of the trials that essentially they made possible. You wouldn't have a trial without them. The least you can do is tell them about the contribution that they made. And then lastly, I just want to thank these people without whom this talk wouldn't have been possible either. So thank you very much.